Okay, welcome. We're here with Dr. Marty Frankel talking about sleep dentistry. Marty, how are you?
I'm doing great. How are you, Steve?
Fine, thank you. Why is it important for people to know about sleep dentistry?
Well, sleep issues are very important, and I think we're getting to know that more in recent years. Originally, I think we used to talk about for good health, you should have proper exercise and proper nutrition, and proper sleep is the third thing in that triad that's really important. Sleep apnea in particular is something that dentists can help medical doctors manage, and sleep apnea kind of comes in degrees, so you can go from very mild to extremely severe, and I guess at the least it can have a really impact on the quality of people's lives, causing them to be sleepy during the day, to fall asleep when they're driving. It can have a big impact on a lot of things. And I guess at worst, people who have severe sleep apnea can die in their sleep if they stop breathing enough. So it's a pretty important topic.
And what kind of problems do people typically run into as a result of having sleep apnea?
Well, I guess one of the main ones is daytime drowsiness, trying to get from point A to point B in their car and stay awake, staying awake at work. Sleep apnea, often people who have sleep apnea also snore, and snoring, as most people know, can have a pretty deleterious impact on people's relationships, their marriages, and intimate relationships with significant others.
And for people that may not have heard of the term sleep apnea, how prevalent is this condition?
Well, at least 10% of the general population suffers with sleep apnea. Of that 10%, probably 10% of those actually get treatment for it. So there's a lot of people out there, millions of people really, who have it undetected, but it's pretty prominent. Especially males over 40 tend to start snoring and having some breathing issues in their sleep, and it can be pretty important to have a look at it. In fact, they say that adults on average go about 10 years with sleep apnea before it actually gets diagnosed. I think people think snoring and that is almost funny, so it's been kind of made jokes at as opposed to being taken seriously. And now I think people are starting to realize that it's quite a serious thing. So I think it'll, once that information gets out to the public, I think people will start to take it more seriously and will be diagnosing more of it.
And what treatments are available to help correct sleep apnea?
Yeah, well, the real sort of gold standard that the medical community uses is a CPAP machine. CPAP is continuous positive air pressure that's delivered through a mask that people wear over their nose, and the air pressure opens the airway and allows air to travel through the lungs into the lungs while people are sleeping, and it makes a huge impact on people's lives. But there's a lot of people that find the CPAP is uncomfortable. They either find that the mask is too tight or there's too much pressure from that, or sometimes, especially people with severe apnea, the pressure has to be turned up higher, and those people just can't tolerate the feeling of it. And that's where dental appliances come in.
Oh, okay.
Dental appliances can be used very effectively to treat mild to moderate sleep apnea, and they can also be used in certain cases for more severe sleep apnea patients as well. And it eliminates a lot of the issues that people have with the positive air pressure. It's an appliance they have to wear in their mouth, though. So, again, there's adaptations that people have to make to get comfortable with it.
And what experience have you had working with these treatments, especially the mouth guards?
Yeah, well, these are I wear one myself, so I guess that's the best experience I've had with it. And I went through, oh boy, probably 4 or 5 different designs. There's so many different companies and designs out there for these appliances. And for me, I found a lot of them very uncomfortable because basically if you've ever seen a night guard that people wear for grinding, it's sort of a plastic or acrylic horseshoe-shaped device that fits over the teeth. Well, for snoring, you have one of those on the upper teeth and one of those on the lower teeth, and then they're joined together. And what they do is they bring your lower jaw forward. When the lower jaw comes forward, the airway opens. And so that some of the connectors in the original designs were on the inside, so they kind of took up the space that your tongue occupies. And they were pretty uncomfortable, I found them to be. But now a lot of the newer designs have connectors on the outside, so there's a lot more room for the tongue, and which is better for sleep apnea, but it's also better for comfort. So,
well, for people that might be in need of an appliance like that to rid themselves of some of the problems that you identified earlier, what kind of benefits can they expect from having a treatment like that?
Well, for one thing, if they do have sleep apnea, that's going to improve. The way they rate whether it's mild, moderate, or severe is the number of times a person basically stops breathing in their sleep, and that's determined by a sleep study. So, a CPAP machine or a dental appliance, by opening the airway, allow a person to breathe more freely, and so the number of times that they stop breathing is dramatically reduced. So that's the main impact. So people have a better night's sleep. They're more rested. They just have more energy. They feel so much better. It really improves the quality of their life. And some people have told me that these appliances have also saved their marriage for a few reasons. One, it's really effective at treating snoring, and so that where people can't share the same bedroom, now they can. But also the person who has sleep apnea, because they're not getting a really good quality sleep, sometimes they're pretty grumpy during the day. And when they start sleeping better, their personality changes. They just become more like themselves, like they used to be, and that alone has saved a lot of marriages.
Well, Dr. Marty, this has been some great information for people who may be suffering with those types of daily issues. What would you say in closing to somebody that may be listening to this interview and is considering addressing some of these problems?
Well, I think it's probably, of all the things that I do in dentistry, I think the sleep aspect of what we can do for people's sleep is probably one of the most important things, because not only does it improve your life, but it can save lives in many cases. So I think anyone who even suspects that they might have it should go to their medical doctor, their family doctor, ask to have a sleep study done, and know that there is help there for people who are suffering with this. Depending on what it is, a dental appliance is often the best way to treat it.
Well, Doctor, thank you very much for this information and certainly your help and insights on something that sounds like it could be devastating for many people. You've been listening to Dr. Marty Frankel on the subject of sleep dentistry and dealing with the condition of sleep apnea. Have a great day.